Hello everyone, my name is Kiran and my group fellows are Mina Jamshed, Hassan Irfan and Hamza Arshid. I along with my group fellows presenting the drug which is Atenolol. So let's start. Atenolol is a cardioselective beta-1 blocker which is used in the treatment of hypertension, angina and acute myocardial infarction. It is the third most prescribed beta blocker. In market, it is available under the various trade names like Tenormin, Atenorm, Zafnol. History of Atenolol. Atenolol is a derivative of one of the first discovered beta blocker which is named as Propranolol in 1962. Propranolol is an unselective beta blocker. Sir James Whyte Black received the Nobel Prize in Medicine in 1988 for the achievement of discovering that drug. Atenolol was discovered as the first beta-1 selective blocking drug in 1976 by empirical chemical industries. Atenolol was discovered by Alvogen Malta under the trade name Tenormin and received FDA approval in September 1981. Chemistry of atenolol. Atenolol is a para-substituted aromatic ring with two different substrates. The substrate at the isocarbon is acetamide functional group, while the other substrate in the para position is called 2-hydroxy 3-isopropyl amine propoxy group, which comprises several individual functional groups. Synthesis of atenolol. No direct natural source is available. Atenolol is prepared synthetically in laboratory in two steps. And the first step, 2,4-hydroxyphenylacetamide reacts with 2-chloromethyloxidine and the presence of piperidine to give 4-cyclopropyl methoxybenzamide. And the second step, the latter compound reacts with 2-aminopropane 1-ol to give atenolol. Pharmacology of atenolol. Pharmacokinetics. It can be administered oral or IV route and it is absorbed from the GIT. Its distribution level is 63.8 to 112.5 liter. It is metabolized in liver and eliminated 85% by kidney and 10% in feces. Pharmacodynamics. So let's start with the mechanism of action. Atenolol is a beta-adrenergic blocking agent that blocks the effect of adrenergic chemicals, for example, adrenaline or epinephrine, which is released by the nerves of sympathetic nervous system. One of the most important functions of beta-adrenergic nerves is to stimulate the heart muscles to beat more rapidly. By blocking the stimulation of these nerves, atenolol reduces the heart rate and is useful in treating abnormally rapid heart rhythms. Atenolol also reduces the force of contraction of heart muscles and lowers the blood pressure. Moving toward the clinical uses of atenolol, it is used to treat hypertension, angina, myocardial infarction, arrhythmia. Therapeutic dose of atenolol. The recommended dose of atenolol is as follows. For adults, hypertension 100 mg as a single dose, and for angina 100 mg as a single dose, or it can be given as 50 mg as twice dose. For elders, the dose is reduced if the patient is impaired with any renal disorder. 50 mg of atenolol is given after every hemodialysis. For children under the age of 12 years, it is not frequently used because it can cause bradycardia. Adverse effect of atenolol. It can cause allergic reaction, depression, unusual weight gain, heart failure, dizziness, headache, bradycardia. It is not given in pregnancy because atenolol can cross the placental barrier and cause physiological changes in fetus. It may cause bradycardia or hypoglycemia in neonates. Hypoglycemia means low blood sugar. Toxicity. If we increase the dose from 200 mg to 5 gram, it can cause the death of a patient. Effects of atenolol toxicity. It can cause new or worsening chest pain, slow or uneven heartbeat, lightheadedness, short of breath, swelling, rapid weight gain, cold feeling in hands and feet. Treatment of overdose of atenolol. The best treatment is giving of glucagon, which is the antidote to beta blockers toxicity. Other methods are emesis, gastric lavage, and administration of activated charcoal.